Alright guys, this is Caesar with Nursing School Made Easy. Today's lecture is going to be on pulmonary embolisms. There's a lot of information on pulmonary embolisms. I'm going to try to give you the most important information that you need for your NCLEX exam. So let's get right to it and let's stop wasting time. Again, today's topic is pulmonary embolism. Get a different pen. Now, the simple definition of a pulmonary embolism is the blockage of the pulmonary arteries. Now, this blockage can be caused either by a thrombus, fat, air embolism, or tumor tissue. The one that I really want to focus on is a thrombus or a blood clot. Okay, so let's do blood clot, thrombus. That is the main focus here. You can also do it due to fat. An example would be, for example, a patient has a fracture of a long bone, such as a femur, ribs, humerus, anything like that. The fat goes into the bloodstream and it causes an obstruction, a blockage. See if we can focus a little bit better. So that would be an example of a fat embolism. An air embolism would be, for example, a nurse that starts an IV with a large amount of air in the IV tubing and pushes that air into circulation. So you do not want to do that. That would be an example of air thrombus, or excuse me, air embolism, air embolus. Number 4, tumor tissue. Now, an example of this would be, for example, there's metastasis, and the metastasis begins to occlude the pulmonary arteries, maybe lung CA. So that would be a way of tumor tissue causing an embolism, a blockage. Again, pulmonary embolism just means blockage of the pulmonary arteries, and we're going to focus on blood clot. Also, you must remember that the blood clot may originate or may be due to something called a DVT, deep vein thrombosis, or it may be referred to as VTE, venous thromboembolism. Same thing, okay? Deep vein thrombosis or VTE, venous thromboembolism. Now, most of these will originate in the leg and work their way up. Now, remember that some patients may complain of calf pain, some tenderness, some redness. You do not want to massage that area, especially again if it's red, if it's swollen, if it's painful, for fear of a blood clot. Now, that blood clot that's in the leg will most likely not travel up because, again, vessels will tend to get smaller and the blood clot will not be able to travel up those small veins. However, if you do massage that area, if you make them ambulate, if you do something to cause that blood clot to break or dislodge, it will travel up to the chest region, to the lung region, and you will cause a PE. Therefore, you do not massage that area, you leave it alone. Okay? Now, another reason for this blood clot formation, we talked about one, DVTs or VTEs. Another reason would be number 1, number 2, number 3, atrial fibrillation. Now, in atrial fibrillation, the heart isn't pumping like it should, and because it's not pumping like it should, it's allowing blood to sit for even just a brief period of time. When it does that, blood has the potential to clot. If that blood clot goes on further, goes to your lungs, goes to your pulmonary arteries, you just caused a pulmonary embolus. So this is why you always want to take care of atrial fibrillation, any type of heart problem, because again, you have the potential of causing a blood clot to form. Now, what are some risk factors? Number 1, immobility. Now keep in mind, Now, for example, truck drivers, they're in a sitting position for a prolonged period of time. If you're taking a road trip and the road trip is 10, 15, 20 hours long, you want to make sure that you stop every now and then and you become mobile. You walk around. Because again, if not, you're becoming immobile. You're letting that blood pull in your legs. You let that blood pull in your legs, you're increasing the chances of having a blood clot because blood is just sitting there. Okay? Especially if there is some type of circulatory problem. Again, you want to ambulate as much as possible. So therefore, risk factors, number 1 is immobility. Number 2, surgery. Especially in younger adults, and especially if they're having some type of pelvic surgery or lower extremity surgery. Remember, your lower extremity blood circulation is decreased. Therefore, again, the likelihood of you getting a blood clot increases, especially if you had some type of surgery. Number 3, patients who have either had a stroke or some type of paralysis. Again, why? Because they're becoming immobile. 4, if they have had a history of DVTs, you want to know that because you definitely don't want to make them immobile. Okay, so if they've had a previous history of DVT, you want to know that. 5, malignancy. For example, lung CA. That mass can become big enough to where it causes a pulmonary obstruction, pulmonary artery obstruction to be specific. 6, smoking. Remember, smoking causes vasoconstriction, making vessels smaller, making it more likely for them to get blocked, to get clogged up. 7, hypertension. And number 8, birth control. There's certain birth control that do increase likelihood of blood clot formation. A few years ago when I was doing CT, there was a span of about a week to 2 weeks where we had 8 to 10 teenage girls come in complaining of chest pain, difficulty breathing, and all of them were positive for a PE. And all of them were taking the exact same type of birth control. So ask them, are they on birth control? If they're women, what kind? Because there are different types of birth control, and there are different types that are more likely to cause blood clots. Now let's talk about clinical manifestations. And again, as with all lectures, please make sure that you know your signs and symptoms, your clinical manifestations, okay? I just briefly mentioned it. Number 1, dyspnea or difficulty breathing. Okay, this will probably be the first thing your patient notices, the difficulty breathing. Again, the blood clot is causing an occlusion. That occlusion is not letting more blood flow in, therefore oxygen exchange cannot occur, and so your oxygen level will go down. As a result, they will have dyspnea, difficulty breathing. Now remember, this is happening in the lungs, in your chest region. Anytime you have ischemia or decreased oxygen, you will most likely have some pain, again, due to that decreased oxygen. So you will also have chest pain. And these are the 2 biggies that you need to focus on. Also, hemoptysis. 4, AMS, altered mental status. Again, this is due to the decreased oxygen or the hypoxemia. 5, anxiety. The anxiety will be due to the difficulty breathing. I mean, you can't breathe, you can't catch a breath. Of course, you're going to become anxious. So these will be your biggies. Dyspnea, chest pain, and anxiety. Make sure you know those really, really well and why. Now, let's focus on some diagnostic studies. The number one thing that you can use to diagnose something called a CT chest PE study, okay, with IV contrast. So again, CT chest PE with IV contrast. This is the number one thing that will help diagnose whether there's a PE or not. Now make sure that you understand that it is with IV contrast, and make sure that you also must know the patient's BUN and creatinine. Okay, if these are not within normal limits, the exam cannot be done. Also, is your patient diabetic? If so, are they on metformin, glyburide, glucovans, any of those, because that will affect the IV contrast. Remember that these patients, if they get the IV contrast, they cannot take their medication for 48 hours post-injection. So again, you must know if your patient is diabetic. You must know if their BUN and creatinine is within normal limits. The other thing that you must know is, do they have an iodine allergy? If they have an iodine allergy, they cannot get the CT exam done. So if that's the case, if they do not meet these criteria, well then what can you do? The next best thing is something called a VQ scan. Now this is a nuclear medicine study. That's the next best thing that you can do. Number 3, something called a D-dimer. Now D-dimer is a test that essentially just says there's more clotting in the body. That's all it really says. Okay, a D-dimer just means there's more clots, there's more blood clotting in your body. So there's more blood clot formation. So if this is elevated, that's telling the doctor, okay, there's increased clotting. That can mean that there's also a PE. This is not definitive, however, okay, because the D-dimer could be a false positive. D-dimer is also elevated with inflammation. Okay, that's why this is not the number one study. The thing you can do is an ABG. Just like I mentioned before, your O2 level will go down. And again, that's due to the blockage of the pulmonary arteries. Blood cannot cross due to, again, to the blood clot. Number 5, serum troponin. Now again, this is not specific to PEs only, because if there's other muscle damage, your troponin will be elevated. The serum troponin here is used to see if there is muscle damage, if there's damage to tissue. So again, the ABG, serum, D-dimer are non-specific. They may also be used to help out diagnose, but they are non-specific. Your two money makers are your CT and your VQ scan. Now, what are you going to do for your patient? What are some interventions? Number one thing you can do is, if they're having some difficulty breathing, apply O2. As always, you want to make sure you help your patient out, help them breathe, give them some O2. Number 2, this is why you put these on, the sequential compression devices, or the stockings, those tight socks. Okay, that's why you put these on. You're trying to prevent a blood clot from forming, especially if they've had surgery. Okay, so the other thing that you want to do is you want to ambulate as soon as possible. You want to get them up and walking, again, so you prevent the blood clot from forming. You're going to put them on some anticoagulant medication, prophylactically or post-op. Something like that could be warfarin, Coumadin, or Lovenox. The other thing you're going to do is, this is not specific to PEs, but you want to put them on their IS, or incentive spirometer. This will help prevent atelectasis. Okay, so make sure you give them their IS. Biggest thing is, again, your sequential compression devices. Make sure you put those on, and make sure you ambulate them as much and as soon as possible. Now, drug therapy. One, something called tissue plasminogen activator, or TPA, and something else called activase. Now these two here, these will actually dissolve the blood clot. Okay, so again, TPA, which stands for tissue plasminogen activator, or activase. Again, these will dissolve the blood clot. Number 3, heparin. So you can put them on a heparin drip. Now, the thing with heparin is it will not dissolve the blood clot. It will, however, prevent from further clot formation. The other thing that you can give that we talked about is Lobanox and warfarin, so known as Coumadin. Now, the warfarin will usually be started within 24 hours and may be given up to 3 to 6 months. Now, make sure you know this for the exam, that the dosage of heparin is determined by the APTT. Okay, again, the dosage of heparin will be determined by your APTT levels, as opposed to warfarin will be determined by your INR. So make sure you know these levels. Okay, again, warfarin will be determined by the INR, and heparin will be determined by the APTT. And last but not least, if the blood clot is unable to be dissolved by these medications, you could also do surgery to remove the blood clot. Okay, so that would be number 6, surgery to remove. And if the patient has recurrent blood clot formation, they may be asked to do something like an IVC filter placement. This will go into the femoral vein. Now, if they're having an IVC filter put in place, they will most likely get IV contrast. So again, the same applies. Are they diabetic? Is their BUN and creatinine within normal limits? Do they have any allergies? Okay.